Take a look at this headline, how an Iowa summer resort region became a COVID-19 hotspot. It is written by Dr. Emily Mendenhall, who is originally from Okaboji, Iowa. She now lives in the D.C. area and teaches at Georgetown. She has authored 6 books and centered her academic career on understanding how poverty and trauma make people sick. She studies diseases. In June and July, when she returned to Iowa to vacation with family, she was shocked to see the response to the pandemic, or lack thereof, with those who are living in or vacationing in that area. She wrote about it in that Vox article, which is an online national publication. She was still in Okaboji earlier this week when I interviewed her. Dr. Emily Mendenhall is a medical anthropologist, also professor of global health at Georgetown University out in the Washington, D.C. area. And she is also the author who published that article that I was referring to there, titled How an Iowa Summer Resort Region Became a COVID-19 Hotspot. Now, Emily, the resort region that you're speaking of is where you grew up, near Lake Okaboji in Iowa. In June, you started interviewing people that you knew in that area. Explain why you even decided to do that. You're there on vacation.
People were very careful, just as we were, for a number of months. And then after Memorial Day, cases spiked and people were done. And so I was curious, how, what are people thinking about? Why have people just kind of stopped staying home? And so I wanted to dig in and try to understand what was behind the spike. Now the numbers are much lower, and this piece was really about what was happening in June and July, and trying to understand and get to the bottom of why no one was following public health recommendations.
You had written in that article, there's an overwhelming ethos of American individualism over collectivism. Why is that important to this article?
So what I think happened is people shifted from really being worried about coronavirus to really being worried about the economy. And they just kind of didn't see space for both concerns. And so they shifted. And I have to say that a lot of the people I interviewed, and I think a lot of the locals, are being very, very careful. And many of them are really concerned that it has become so political. But many of them are staying home. And many of them are rejecting the notion that it's political and really being careful. But there are people who, many people, and many tourists from all over the Midwest who have come to Okaboji. And I think there's been a lot of spread around the Midwest from this region, from our local economy.
The divisive atmosphere isn't uncommon. It's become quite partisan. And you live out in the Washington, D.C. area. You are in academics. And there is a mindset that those who wear masks, those who aren't as worried about the economy as they are of health, is more liberal thinking. And on the opposite end of that are those who are saying, you know what, I don't want to wear a mask. It infringes on my rights as an individual. So speak to that a little bit.
Yeah, well, I think that we've seen this shift. I don't remember this as a young person, and many people I've talked to since the article was out, which has been quite a number of people wanted to connect, have said, I really have seen this shift since childhood, probably in the last 10 to 15 years, as the country, as the nation has fractured politically. We've seen these really stark divisions. And I was really surprised, actually, by how many people were talking about how they felt very uncomfortable going out in public. When we lose when we lose state leadership, the local level really grapples with what the local needs are. And at the time, in the 100 Days of Summer, most Okaboji residents, Lakes Region residents, had other pressing matters at mind. Is really, really good example of the need for federal leadership, the need for state leadership during a public health crisis.
With that said, there are a lot of people, though, Emily, who agree with the state leadership as it is right now in Iowa. Yeah,
and people disagree with what motivates our society. What motivates how to keep people healthy, and this is the big debate in America, and it is fundamental. It is centuries long, and I think that what we're seeing with coronavirus is that we're seeing this idea of individualism and this idea of lack of state intervention really unravel our society and unravel what holds us together, and also creates extraordinary risk for our most vulnerable. Without for example, tonight there is a school board vote in Spirit Lake where they're discussing should they require masks or recommend masks. And people around the town are really, really worried if they don't require masks, those who need to wear them, those who are at risk, including teachers, including students, will face a lot of shaming and a lot of ridicule. And then on the other side, there's a number of parents who are saying, if you require masks, I will not send my children to school. So, you know, without state legislation saying that everyone must mask, I mean, the great example in this community is actually Walmart or Menards, which are companies that are beyond the local level that have, Walmart, for example, has a nationwide mask mandate where everyone there, I mean, people can choose not to go there, but many people are just wearing masks and dealing with it. There are some people who are either boycotting or being deviant locally or within the store, but overall people are pretty comfortable or actually following those recommendations. And there are ways to encourage participation and protect our most vulnerable. And it's really disappointing to see the conflicts around these protective measures emerge.
It also comes back to the point that I keep hearing from other folks saying the conflict really started at the beginning of the whole mask debate because we were hearing they don't really do anything to protect, therefore we didn't have to wear them at that time. So this would have been around April-ish. And then to come out and say now everybody has to wear one, those who are fighting the mask mandates are saying it's more so because you can't prove that it works. Now you're just trying to make me do something I don't want to do.
Yeah, I think what's going on here is, you know, we are experiencing history in real time.
Yeah.
You know, I teach about pandemics. I teach about, you know, the Spanish flu. I teach about the plague. I teach about Ebola. I teach about smallpox or guinea worm, these big eradication programs. I do research around the world on diabetes. And there are these, you know, decades-long studies of understanding different illnesses, but rarely in Northwest Iowa do people face a pandemic, or have they, you know, for 100 years, faced a pandemic and had to deal and respond and evolve in real time. And what we're seeing is a hyper knowledge-based world. People are accessing so much information around the science being made, and science is about understanding and learning and developing and responding. And so, yeah, there has been different views emerging, and now there's pretty strong collective views by the public health community and medical community that masks really work and they protect the most vulnerable. And I think that's the most important point, is that people say, it's my choice to wear a mask, but it's not about protecting you. It's about protecting others. And I think that is what's really being lost in this conversation on masking. And to be honestly, that is really what's disappointed me about this project, is that people are not realizing the significance of what that small masking does, just like wearing pants, does to protect those around you.
Dr. Emily Mendenhall, I appreciate your time so very much on this. I hope you enjoy the rest of your vacation there in Iowa.
Thank you. Thanks for this opportunity. And everyone be well and have a great summer.
And thank